Alright, so we'll quickly look at the cervical collar or bracing. The cervical collar, or say cervical collar or bracing. So for the cervical collar or bracing, it's just all about maybe your neck is not as stable, so you just want to stabilize it. You just want something to immobilize what? The neck. So let's talk about this and also the importance of this. Okay, so what we have is you should know that both cervical collars and also spinal braces. Okay, so it's actually spinal braces. So they are orthotic devices and they are designed to what? Stabilize the spine. Of course, the spine passes inside the neck before it goes to the head. Do you understand? So a cervical collar now is that one at the neck. Okay, it's a neck brace, soft or rigid, and it supports and immobilizes the cervical spine. Types, we have the soft collar, which is made up of all those foam. Do you understand? Then we also have the rigid one, which is plastic. That one you can't be able, there's no comfort for you even. You know, that one restricts any movement, flexion, extension, rotation, is restricting everything. Then indications, that's when you should use this. If there's a whiplash injury. So whiplash injury is like a car accident where you just move your neck to the front and all of that. You know, suspected cervical spine fractures. Post-surgical support, and also chronic neck pain and cervical spondylosis. So limitations is it leads to long-term use of muscle atrophy, stiffness, and skin breakdowns. May also increase intracranial pressure in head injury patients. Can also obstruct the airways. Therefore, the spinal braces, I'm coming. So for the spinal braces, they are basically applied to stabilize larger portions of the spine, like in the cervix now, in the cervical now, in the whole place, the whole cervical vertebrae will be immobilized. If you come to the thorax, the whole of them will be immobilized. If you go to the lumbar, the whole of them will be immobilized. If you go to the sacral region, all of them are immobilized. You understand? So they are classified based on the region. So cervical thoracic is for the cervical region and the thorax region. Thoraco lumbosacral is for the thorax region, the lumbar region, and also the sacral region. So you use this when there's a lot of trauma or spinal fractures or post-spinal fusion surgeries. Okay, use it also in scoliosis or kyphosis, and also pain relief in degenerative spine diseases.